Hi, I'm Kenny. I'm a last year medical student and I had an ischemic stroke just over a year ago at 27 years old, primarily affecting just the left side of my body, both the upper and lower extremity. My pre stroke physical baseline was very high. If we think of pro versus amateur versus like an enthusiast athlete, I was probably in the top roughly 10% of my age group for amateur athletes regarding speed and strength. I went to the gym 6 to 7 times a week, and I was played reasonably competitive basketball or soccer about once a week, sometimes twice a week. At this time, most of my deficits are with balance and muscle coordination. There is functional strength present for the most part in both my upper and lower extremity. I'm personally weird in the sense that I didn't really have notable muscle atrophy on that side of my body. It's very common for people with strokes to have muscle atrophy over time, simply just from lack of use. Also, I've had almost no spasticity, which is where the muscles contract with difficulty in terms of they contract forcibly and you're not able to extend or flex depending on what direction the contraction's in. So I've had almost no spasticity at all during my recovery process, which is somewhat atypical. There's usually some spasticity um, involved with stroke recovery. Except for when I start walking and try to make rapid upper extremity movements, I probably look pretty healthy from the outside looking in. But when I'm making compound movements, which is when I'm moving multiple muscle groups at the same time, I have to coordinate large groups of muscles in a specific order, especially the lower extremities. I start to look awkward, and the faster I have to do it, the less fluid it feels, and the less fluid it looks as well. That being said, from the outside, it usually looks like I'm doing fine, and I am, but often there's a lot of focus on keeping things moving at the right time and keeping muscles aligned properly. A good example for me personally is my glutes, hamstrings, and my lower back muscles, keeping them straight during my leg loading phase of a normal gait pattern. So keeping them straight when I'm walking and I'm essentially standing on one leg during the walking pattern. I currently can't dorsiflex my left ankle when my leg is extended. I've also been told by a physical therapist that because I tend to keep my left hip flexed and left foot off the floor longer than I should, I end up loading my right leg longer than needed, and that forces me to lean towards the right more, which is in part causing my current limp. The upper extremity is less problematic in this regard, but movements still feel less fluid and take a lot of effort to make sometimes. I'm a little bit weird in that finger extension usually takes longer to get back, but I had it back very quickly. Even in the hospital, I had finger and wrist extension relatively quickly. I had it. That was one of the first things to come back actually. At this time, my finger flexion is currently present, but it's more difficult to control and isolate specific movements that are part of normal finger flexion. So I will try to demonstrate with my right, which is my unaffected arm, how well my left arm is doing. So I can extend things very, very easily and quickly on my left side. Um, Flexion, I can do it, but it's far less controlled. Sometimes when I'm moving in a tighter space, I'll just go dead quiet. Nothing's wrong. I'm just concentrating on coordinating muscle groups to move well and in the right order, so I can move through the space quicker or just get through things while looking as quote unquote normal as possible. Now, my issues are specific to me. Other stroke survivors may present differently at different time frames of their recovery process. The biggest takeaway here should be that what you see and what the stroke survivor experiences can be wildly different things, and that what I'm showing for myself, they're just motor deficits, right? At baseline, all the tiny little adjustments our bodies make to maneuver are often done implicitly, arguably subconsciously. But after a stroke, we have to think about these things much more actively to perform them. Because your body's, at least when you're healthy, your body's just used to making all these movements with very little effort on your part. It's done subconsciously with you've done it so much. It's just at this point, it's not something your brain really puts out a lot of effort to keep track of as you do it.